Hi everyone, my name is Isabella and I'm with the team here at the American Society of Transplantation. I work specifically with our Power to Save initiative and I hold the role as the Transplant Community Program Manager. During these times in the COVID-19 pandemic, we understand that the transplant community still has many questions and concerns that they don't have the answers to. Because information is also always changing, I'm joined by 4 wonderful physicians who are members of the American Society of Transplantation, who are happy to provide some answers to some of the questions and concerns that you might have. We have Dr. Vinita Kumar, a transplant nephrologist at the University of Alabama in Birmingham. We have Dr. Camille Nelson Cotton, an infectious disease physician at Massachusetts General Hospital. Dr. Megan Morales, an infectious disease physician at Virginia Commonwealth University Health, and Dr. Ron Parsons, a transplant surgeon specializing in kidney and pancreas transplantation at the Emory University School of Medicine and Medical Center.
Is it safe to get a transplant now, or should I wait?
Thank you, Calvin. That is a very good question. Safety after transplant is a very patient-specific question, and this should be discussed between you and your family, first of all, and then also between you and your transplant center. It's important to remember that, for the foreseeable future, the risk of acquiring COVID-19 will never be zero. For those who are, waiting for transplant and their families, it's going to be important to practice what I like to call the big 3. So wearing a mask, doing social distancing, and good hand hygiene technique, the big 3 is going to be critical for all family members and patients waiting for a kidney transplant. In terms of the risk of actually acquiring COVID-19 after transplant, it's, again, patient-specific. It's going to depend on your location. It's going to depend on your underlying health. Also, in terms of how much exposure you have to other people because of your end organ failure. For instance, people who are going to a crowded dialysis center are potentially at more risk versus not having to go to a dialysis center or go to a place that has lots of people. The other thing to keep in mind is that patients who undergo transplant now can still have excellent outcomes. However, the risk of acquiring COVID-19 remains real. And this may put you at increased risk of complications and even death after transplant.
When someone in the future gets a transplant, what is the likelihood that they get COVID?
Calvin, thank you for asking that question. I've been getting this question a lot. Again, risk of getting COVID by hospitalization is extremely low, especially as most transplant centers are doing many things to keep you safe. Hospitals have strict isolation policies in place and are isolating patients with COVID-19. They're also asking for universal masking and hand washing precautions of all healthcare providers. They're also minimizing visitors to the hospital. And when visitors are allowed to come, they're requiring masking, hand washing, as well as social distancing. Hospitals are also advising employees on how to avoid COVID in their daily lives. For example, some hospitals have very strict travel restrictions in place and have strategies in place for their employees with any suggestive symptoms or any unexpected exposure. So again, we also want you to have an open conversation with your transplant center about what they have in place to minimize your risk of getting COVID-19 while hospitalized, Calvin. It's scary to think about getting COVID, isn't it? Well, let's talk prevention first, Calvin. So if you're practicing safe living like following your local masking recommendations, hand hygiene, social distancing, this will reduce your risk of getting COVID greatly. As far as we know, your risk of getting COVID after transplant is similar to the general population. But this also depends on how much virus is circulating in your local community and what you are doing both at home, at work, and in your daily lives to protect yourself. Kelvin, it's important to remember that every state has its own rules and regulations, but just because a state is opening and not masking, we're still asking you to be more cautious and still follow the masking and hygiene and social distancing recommendations. If you get infected with COVID-19, our limited but growing experience, such as mild infections, can occur in transplant recipients. However, immune suppressed transplant patients may be at risk for getting more severe infections due to COVID-19 in some cases, especially if our immune suppressed patients have other risk factors like diabetes, older age, heart disease, high blood pressure, obesity. We've seen a wide variety of disease severity. And this is not unexpected, Calvin, because sometimes we see transplant patients can have very variable responses to even other viral infections, not just COVID-19. Most people do okay, even if they need to be hospitalized. But again, the variety of disease severity exists. But our hope is that if you get it, you won't get too sick. End-stage organ disease, end-stage organ failure of any kind is a risk factor for more severe disease with COVID-19 infection. So if you're a patient, for instance, with end-stage kidney disease, then dialysis is life-saving, right? One needs dialysis to live. So self-quarantining at home is not an option for most patients, unlike a transplant patient. And dialysis centers being enclosed spaces and group settings, that raises concern for increased risk of COVID-19. The thing is, dialysis centers, it's very similar to hospitals, have guidance from CDC and local health departments to decrease the risk of transmission of COVID-19. So we encourage you to talk to your dialysis centers about the policies they have in place for your safety. For instance, in our local community, dialysis patients are called the day before to screen for symptoms. Once they drive up to the dialysis center, they're asked to wait in the parking lot until it's their time. If they've used public transportation, yes, then they enter the building. And every patient before they enter the building, as well as the providers in that building, are screened both with temperature and history. And so again, we ask that you talk to your center to find out what they have in place to keep you safe. So Kelvin, the message really is, if you have friends who are dialysis patients, please share with them that they should not skip dialysis because of the fear of getting COVID-19.
If I had COVID-19, when can I get relisted?
Thank you, Calvin. That's another really good question. We have learned a lot about COVID-19 and what it means to go on to get a transplant, but honestly, there's a lot we still don't know. And there's a lot of differences between centers, and so local situations and transplant-specific situations are going to matter greatly. The ideal disease-free time period before transplantation is not really defined and probably differs at different transplant centers. And your center will assess you for recovery from the virus before transplantation. But in general, I would say you have to talk to the place where you're trying to get a transplant and review with them what their policy is. I know at my center, we like to see that the patients have had full recovery from COVID-19. And we also have require that there's a minimum of 30 days that have passed since the initial positive test was found. So, but again, that is just at my center, and yours or other centers may be different or have a different time frame for that.
What should I do if my area is beginning to reopen?
Thanks, Frank. That is a great question. For many of us, reopening is almost more complicated than when we actually close down. For transplant patients and other immunosuppressed patients, there may be still a significant risk of disease transmission. In general, we would recommend that you continue significant precautions, in other words, continuing to use masks, excellent hand hygiene, and social distancing. We would generally recommend doing that until the disease rates are truly very, very low in your community and we feel safe again. As I'm sure you've seen in the news, sometimes when communities open up, disease transmission gets worse, and we definitely would not want you to get caught up in that. We are getting a good number of questions about returning to work. Most of us do need to continue to go to work in order to have income and benefits such as health insurance. And we would recommend that you speak with your employer about ways to make your work environment as safe as possible. You might want to speak with your transplant team as well about the details of your work exposure in order to get optimal guidance. Also, many patients want to socialize with friends and family. Unfortunately, many of the cases of disease transmission that have occurred after contact with friends and family. Those who are most dear to us could actually be a significant risk, which is really challenging. Unless you have been entirely sure that they have been practicing flawless, strict social isolation for at least 2 weeks, we would recommend that you be very careful when interacting with friends and family. In other words, maintaining 6 feet of distance, wearing a mask, practicing excellent hand hygiene, and not sharing food or eating utensils. It's always safer to get together outdoors rather than indoors. And just to highlight that one of the higher levels of risk involves removing our masks in order to eat or drink. So you might want to consider getting together with people without actually eating or drinking. It's currently summer, and because it is generally safer to get together outdoors, we would recommend taking this opportunity to carefully and safely enjoy ourselves outdoors. We would encourage you to have as enjoyable a summer as possible during these challenging times. We would recommend that you get out of the house, walk around the block, walk down the beach or on trails, get some exercise, go for a drive, staying socially distanced and wearing a mask, but do enjoy yourself. We think that's good for your body as well as for your mind. Thanks.
What should an immunosuppressed transplant recipient do when re-entering the workforce in a COVID-19 world?
Well, thank you. That's such a great question. So even though our workplaces and communities are reopening, people who have received a transplant still need to keep a very high degree of vigilance and be safe. Just because it's open doesn't necessarily make it safe for you right now. So fortunately, most transplant patients are used to taking additional precautions, but especially right now, continuing to practice good hand hygiene with soap and water, or of course your alcohol-based sanitizer, and continuing to wear a mask outside of your home and maintain physical distancing are all very important things. So you might have a cloth mask, like this one. It could be a surgical mask, a medical surgical mask like this one, or even an N95 or respirator type mask. Whatever you're using, you should just make sure that it shouldn't be so loosely woven like a bandana or something. So if you hold it up to the light, you'll see the light streaming right through a bandana. So that's probably not going to be the most safe option for you. Similarly, even though it might make it more comfortable, some masks who have big relief valves on them are also not as safe for you to be using. But the most important part of whatever mask you choose to wear is to cover both your nose and your mouth. So when you wear it, make sure you cover nose and mouth. And then also make sure there are no big gaps around the edges, and that will keep you safe. There have been some questions raised about the concerns of being harmed by wearing a mask. Normal mask use should not be a risk to you, but it does potentially carry great benefit to protect yourself and others. We don't know yet if there's a benefit of wearing a face shield plus a mask versus a mask alone, but depending on what situation you're in, you might want to have both available. Face shields or other eye protection are actually quite comfortable when you're used to it and may add additional protection plus extend the life of your mask. Eye covering will actually help keep you from touching or rubbing your eyes accidentally. So you might find a more traditional face shield like this with foam that sits securely against your head. Or you can have something like this that attaches to your baseball cap. The important part of this is that it will keep you from touching or rubbing your eyes accidentally. You want to make sure that the shield comes down below your chin and wraps around the side of your face too. Of course, avoidance is still best. So keep socially connected for your well-being by phone and video chats, while physical distancing of about 6 feet at least from others as much as you can. Continue to take advantage of delivery and curbside options or electronic services as much as possible. If you have to go somewhere, think about whether there may be a less crowded time for you to go. So overall, your rules of thumb are: 1, wear a mask; 2, outdoors is better than indoors; 3, keep 6 feet apart whenever you're able; 4, wash your hands regularly, especially after touching any shared surface and certainly before touching your face or your cell phone or something like that. And last, think creatively and plan ahead to avoid unnecessary outings. We'll come out the other side of this together, but it's not quite time to let your guard down yet.
My pharmacy is able to give me only a 30-day supply of my medications, and I hear that 90 days are what I should have on hand. Are there ways around this limitation?
Thank you, Frank. Some of the supply chain issues have stabilized now, so that's the good news. It may be less urgent than it was initially, although it's still a good idea to keep extra medication supply on hand if you're able to do it. The best thing to do is to talk to your pharmacist or ask your insurance provider about an exemption if they have that 30-day rule, since many are now allowing it. Or you can also ask about mail-order pharmacy options, which often allow for a larger supply. If needed, you could request a letter from your transplant coordinator to turn into your insurance, explaining that you would like to request a 90-day supply. Sometimes even filling your prescriptions only a week early at a time is allowed and still will help you get ahead and have a little bit of extra supply at home. Other things that you might want to think about keeping on hand too would be fever-reducing medications like Tylenol, if you're cleared to use them by your team, a working thermometer, or even a pulse oximeter, which is available now through most pharmacies and many online shops.
Is it safe to go to the clinic for procedures or to the lab if I don't have any symptoms?
Frank, the idea of stepping out of the house is really worrying, isn't it? Especially for a lab or a test. So let's start by first asking, is the test necessary? So we would like for you to call your transplant center and ask them if that particular lab or test is necessary to do now. If the answer to that is yes, that it is necessary, then focus on what is the best location to get you tested. So if your team feels the test is necessary to do now, contact your lab and see if they can do your labs at home. If home testing with your routine lab is not an option, you could then ask your lab or your transplant team if there are other local labs that can provide in-home testing services. Something to note though, Frank, is that not all health insurance plans cover lab visits at home. So you should contact your insurance provider to learn about your coverage. Now, most patients probably will need to leave our homes. And how do you keep yourself safe if you leave your home to get a lab or a test? So we say first, check with your medical facility if they are doing the lab or test that you're seeking. If they are, check if you need to make an appointment. Our recommendation is that it's best to go somewhere where you can make an appointment so you can avoid sitting in a crowded waiting room. Oftentimes we tell our patients to wait in the car until it's time for them to go in. Find out ahead of time what precautions that medical facility you're going to is doing to keep you safe. Some of the things are checking temperature of patients coming in or anybody else entering the building, asking questions to check patients for active COVID-19 as they're entering the facility, and then also requiring masking, keeping the appropriate 6 feet distance in the waiting rooms and procedure areas. It is also important that you take measures to keep yourself safe and take measures to reduce the chance of getting COVID-19. So the same thing again, before entering a building, be sure to wear a mask when you go outside your home. keep that 6 feet distance again between you and the other person. And then obviously hand washing. And if hand washing is not an option, then using an alcohol-based gel. And then, of course, you keep hearing this, very hard to do, but especially when you're out in a medical facility, do not touch your eyes, your nose, your mouth, things like that. Now, if the need to step out is for an office visit with your doctor or consultant, then ask if the option of telemedicine is available at your medical facility, especially if it's a routine visit and you're not having an acute issue. For patients with acute issues, your transplant team may want to see you in person, and if that's the case, ask what precautions will be taken to keep you safe. Video visits can be really good substitutes for in-person visits and maybe a better way to connect with your providers than telephone visits. And if that's an option, ask your healthcare team what they offer so you can make sure you have the tools already set up at your end to do your telemedicine visit most effectively. So I hope that provides some reassurance, Frank.
If a family member is working in a high-risk area, what precautions should I be taking?
We understand that this can be a very uncertain time, not just for people who are waiting for or who have had transplants, but their families and friends too. So the first option for that family member would be to have a discussion with their employer, see if there's any modifications that can be made, like working remotely or reassignment to a lower risk area. He or she can explain that they have a family member with a compromised immune system, so anything that they may be exposed to at work could potentially reach them at home as well. Your transplant center may be able to provide a letter explaining this as well, especially if someone is a caregiver to someone with a transplant, like a parent of a child who has had a transplant or a similar situation. For many people, though, this may not be an option. So after that, we recommend following many of the same principles we've talked about for transplant patients themselves, so that family members are protected and in turn protecting their loved ones. Things like wearing a mask and eye protection, washing hands regularly, and changing and washing up before or immediately when you arrive home.
What symptoms should prompt me to seek medical attention or to seek out my transplant provider? Who should I call, and what is concerning and what isn't?
If you are concerned you may have COVID, here are my recommendations. If you have a fever or other symptoms of infections, including cough, achiness, sore throat, diarrhea, or loss of your sense of taste or smell, contact your transplant center for guidance. They will help you with decisions regarding testing, more specifically location of your testing, whether you'll need an appointment. Most places are asking us to make appointments. And then more importantly, listening to your symptoms, they may be able to tell you if you need immediate medical evaluation. Now, if you're short of breath, lightheaded, very drowsy, can't keep up with your fluid intake, you should definitely seek medical attention immediately. And for that, you may want to go to the hospital closest to you. And if that is not your transplant center, that's okay. Go to the hospital closest to you. And when you present for your medical evaluation, wear a mask during your travel and immediately upon entering the building. The mask during travel is to protect the person who's driving you there. The mask when you enter the building is to not only protect the other people there, but more importantly, not all symptoms necessarily are COVID. So in walking into a medical facility, you want to protect yourself too. That's where wearing the mask is going to be really important. Now, if you have a medical emergency, Dave, and what qualifies as a medical emergency? So significant shortness of breath, chest pain, inability to stay awake, stroke or weakness, then you call 911. Some of these are symptoms that you may not be fully with it to be able to call 911. So you want to have a conversation with your family to say what kind of things should make them call 911 for you. And when you call 911 for these above symptoms, If you've been exposed to someone with COVID-19 or have suggestive symptoms, notify the dispatcher so that appropriate safety precautions can be taken on their end too. So thank you for asking that question.
What precautions are likely necessary if I develop COVID and then I recover?
That's a great question about what precautions to take if you develop COVID-19. So, we've actually had a good experience overall with transplant patients getting COVID-19. The vast majority have done quite well. Hopefully you will recover and start to feel better soon. Things to look out for, if your immunosuppression was changed during your hospital stay, you may wish to talk to your transplant team about whether you should go back to your usual regimen or whether they want to keep you on the new regimen. And then if you were treated at an outside facility, a hospital that you're not usually at for your transplant work, and especially if your transplant program doesn't know about it, you should talk with your transplant team about any medications you were given, especially if you are still on them after you are sent home. And you also might want to have blood work checked to be sure that your transplant function is unchanged, especially if you are a kidney or liver transplant patient. Once you have recovered from COVID-19, there are various approaches to regarding clearance for return to the community and to work. Some are based on time and some are based on testing. In general, these would be similar if it were either you or a family member living in the same household who developed COVID-19 infection. And these actually are available on the CDC website in case that's helpful to you. But as far as a symptom-based strategy for clearance, it is recommended that there be at least 3 days that have passed since the last manifestation of symptoms, including things like fever or respiratory symptoms, shortness of breath, cough, things like that. And then that there be at least 10 days that have passed since the symptoms first occurred. What we call a testing-based strategy would be that you've resolved all of your symptoms, no longer have fever, cough, shortness of breath, anything like that, and then that you have negative test results on a swab, not the antibody testing, but the swab, done at 2 tests at least 24 hours apart. And so whether you have COVID-19 or a family member, we would want you to be super careful about ongoing exposure. And if you do have a family member in the home, it's really important to think hard about how you want to protect yourself, protect other family members. One thing you want to avoid is not having an ongoing outbreak in the home. So do take the utmost of precautions, social distancing, don't share a bathroom, don't share a kitchen, things like that. And again, there's more guidance on all of these topics on the CDC website.
If I get COVID, how will I be treated?
So the best treatment of COVID-19 is under constant study, and we're constantly updating that. Right now, though, people who have had transplants are treated largely the same as any patient with COVID, meaning that those without symptoms or only very mild symptoms may actually be monitored remotely from home. If someone is admitted to the hospital, they might be eligible for the antiviral treatment remdesivir if they're requiring oxygen. People sick with COVID can also receive convalescent plasma, which is a treatment made up of antibodies collected from people who have recovered from COVID infection, much the same as you would get any other similar blood transfusion. This is being done through clinical trials currently. If someone is requiring oxygen, they may also go on an increased dose of steroids. The main difference for a transplant patient will be managing your immunosuppression medications. That's going to be an individualized decision for you and your transplant team, but it may look something like decreasing mycophenolate and continuing or even increasing your steroids. Just make sure to speak with your physician or transplant team before you make any changes to your medications.
What have been the outcomes for transplant patients who have gotten COVID-19? Do they suffer more or less than patients who are not immunocompromised?
That's a great question regarding outcomes and morbidity and mortality. So, this is somewhat of a challenging question to answer. Fortunately, we have not seen tremendous numbers of transplant patients getting sick from COVID-19, and I actually think that transplant patients are really good about protecting themselves from infection, and many transplant patients, it seems, really understand the risk of COVID-19, and so fortunately, we haven't seen necessarily very high disease rates, which is great. I will say that our treatment options, our understanding of the disease, treatment options, and overall clinical management has really gotten a lot better in recent times. So that's really been terrific. Transplant patients can often be in some of the clinical trials and receive the ongoing treatments that are available to many other patients as well. We did, many of us participated in a survey that was done, a study that was done through the University of Washington, where they looked at almost 500 organ transplant patients. And although it doesn't compare to a regular population, in general, many of these patients did quite well. This was purely those who were hospitalized, although about 31% went on and did need to be on breathing machines. One thing that I thought that was interesting from this is that the risk factors for overall not doing as well among this organ transplant population was people over the age of 65, or those that have congestive heart failure or chronic lung disease, or obesity. So I think it's good to really, for all transplant patients, to fully appreciate their risk, and then to think about if they do have comorbidities or other diseases, and how they might maybe optimize things like diabetes, or try to stay as fit and healthy during this time as possible, hopefully in order to improve their outcomes.
We really hope that these conversations have helped ease your mind and provided you with some answers that you may have been looking for. As we've seen so far, information surrounding COVID-19 is always changing. So we want to be able to help you keep up to date by visiting our COVID-19 resources available to you on power2save.org. We want to try to keep this information as up to date as possible, and have been trying very hard to do so. We hear you, and we want to be a reliable resource for the transplant community to know and to trust. On behalf of the American Society of Transplantation and Power to Save, we thank you so much for watching. Take care.